Assalamu alaikum, students. Today I will tell you about the congestive heart failure, which is the topic of cardiovascular pharmacology. Tell you about the pharmacotherapy of the congestive heart failure, which includes the inotropic drugs, number second, vasodilators, number third, diuretics, number fourth, aldosterone antagonist, and number fifth is the beta blockers. Drugs used in the heart failure. Number first is the inotropic class. Number second is the vasodilators. Number third is the diuretics. Number fourth is the aldosterone antagonist. And number fifth is the beta blockers. Now I will tell you about the number first drug, which is the inotropic drug for the congestive heart failure. Like the carrot placed in front of the donkey. Inotropic drugs include the cardiac glycosides, which includes the digoxin and the digitoxin. Sympathomimetic amines like the dopamine and dobutamine, and the phosphodiesterase inhibitors, which includes the amrinone and milrinone. Number first of the inotropic drug is the digitalis. Digitalis remains notorious today for its very narrow dosage window for therapeutic efficacy without toxicity. A unique process which is called the digitalization for dosing digitalis, which is also known as lenoxin, digitoxin, which is known as cristodigin, has been widely accepted over the years as a means of minimizing toxicity. This process is to start patients on the several repeated doses of the digitalis over 24 to 36 hours before establishing a lower daily maintenance dose. Includes a cardiac tune-up center, routes and the peaks. The routes are oral, we can give the orally and IV intravenous, and the time to take its steady concentration to its peak from oral route is to 4 to 6 hours, and from the intravenous route is to 1 to 4 hours. The toxic level of digoxin is greater than 2.5 nanogram per ml. Okay. First, we'll need 1 to 5 ml of venous blood in red top. It's important to keep the levels 0.5 to 2 nanogram per ml because above than 2.5 nanogram per ml is toxic concentration of the digitalis. We use only digoxin in our hearts. The person says before you add digoxin that hearts need to run at 60 bpm. Okay, check your potassium levels before each fill up. He said that the digoxin decreases the heart rate. So you have to check the heart rate that it doesn't go below the 60 beats per minute. Okay, it should be normal level because if it is below than 60 beats per minute, then it leads to bradycardia, which is not acceptable. Okay, so you have to take care of this, that you have to you have to maintain your beats per minute above than 60 but not above than 100, because if it is above than 100 then it leads to tachycardia. So digoxin level or digoxin is for low treated for to low the tachycardic level. Okay, which is the 100 beats per minute. We have to low the 100 beats per minute to 70 beats per minute or 80 beats per minute. Okay, now the mechanism of action of digoxin, which includes the sodium or calcium exchanger, sodium potassium ATPase. Okay, in calcium comes inside the cell and outside the cell. Okay, there is increased binding of calcium inside the cell, which leads to increased inotropy. Inotropy means to decrease the decrease the cardiac output. To increase the cardiac output and to decrease the beats per minute, to decrease its contractility. Okay, the sodium per calcium exchange works to in and out of sodium level. So there's an increase in calcium level inside the cell, and there's increase in sodium level inside the cell. The sodium potassium ATPase helps to let the potassium inside the cell, and this all process leads to increase the inotropy. Means increase the inotropy means to decrease the tachycardia and to increase the cardiac output. Digoxin. Comparison of the systemic availability and equivalent doses for oral 56 preparations of lanoxin. The product is the naloxone tablet whose absolute bioavailability is 60 to 80%, and the equivalent doses in mcg among dosage forms are 62.5, 125, 250 and 500 which is whose units are mcg. The lanoxin injection, which is given obviously intravenous, whose absolute bioavailability is 100%. Equivalent doses in mcg are 50, 100, 200 and 400. For example, 125 mcg lanoxin tablet is equivalent to 100 mcg lanoxin injection per IV. Okay, because lanoxin injections have high bioavailability, which is 100%, and tablet have 60 to 80% bioavailability. Okay, thank you.